If you're watching this video, it's probably because you're a doctor or in the healthcare industry, and a parent sent this to you to try and explain why leucovorin is an important topic to have a discussion with you about. All right, so today I want to address a topic that's gaining traction on social media, especially TikTok, where parents are sharing their experiences with leucovorin, also known as folinic acid, for their autistic children. So this video is specifically for medical professionals who want to understand the science behind these stories. Hi, I'm Dr. Theresa Lyons. I have a PhD in computational chemistry from Yale University, and I have spent over a decade translating the science of autism for parents and healthcare professionals. Autism became my focus when my daughter was diagnosed. My daughter benefited so much from me knowing the science that I felt I needed to teach others. So here I am. Parents come to me because they want trustworthy information. Healthcare professionals follow my work because I translate complex research into clear, actionable science and hopefully make your jobs easier. That's my goal anyway. Today, I want to talk to you about something parents are bringing into your offices more and more often: leucovorin, also known as folinic acid, and autism. In the past year, TikTok especially, but other social media platforms have exploded with parents sharing personal stories of their autistic children experiencing breakthroughs in speech, engagement, motor control, daily living interactions, after starting the prescription folinic acid, leucovorin. This means you, as a physician, may be getting more questions and maybe even more pressure about prescribing it. And you might have some resistance, which is totally fair. Some of your colleagues are writing the prescription and others are hesitant, often because they haven't seen the body of research for themselves. And that is totally understandable. There is no pharma rep walking into your offices with a nice prepackaged summary. Folinic acid is generic. There's no sales push. There's no sponsored CME. There's absolutely no profit engine for anyone to come into your office and explain the science on folinic acid and autism. So that's why I've spent hours in PubMed reading and compiling and fact-checking the data so that you can see exactly what's been studied without bias or cherry-picking. Here's what the peer-reviewed research shows. I'll give you a high-level summary, and then we'll go into studies. Cerebral folate deficiency is present in a subset of children with autism. Many of these children test positive for folate receptor alpha autoantibodies. And what they do is they block the folate transport into the brain. So the key thing here is if you have any doubt, any uncertainty, do the FRAT test. That's the folate receptor alpha autoantibody test. It's a FRAT test. You can order it. It's a specialized test. That is definitely the greatest starting point, is to do a test to confirm whether there is an autoantibody or not. If the FRAT test comes back positive, many doctors feel much more comfortable prescribing leucovorin. There are still some doctors, if the FRAT test comes back negative, they do trial low-dose leucovorin just because they have a bit more experience with when the test is positive and seeing the different benefits. So many times, even if the test comes back negative, doctors trial a low-dose amount of leucovorin. All right, let me put on the screen some of the studies that summarize the research that has been done on leucovorin and kids with autism worldwide. We'll start with James et al. From 2009, and it's an open label design of the clinical trial. And this was basically like the first one. You can see there's 40 children with autism, and the intervention was methylcobalamin, so B12 shots, with folinic acid. And the folinic acid, the dose here was very, very small, 0.4 milligrams twice a day. Duration 12 weeks. 12 weeks is the common amount of time that it's been studied. So when you're looking at your patients and you're starting to analyze if there's benefit, just make sure to keep that 12-week duration in mind. So in this study in 2009, it was open label. The key outcome was they were able to see improved metabolic markers and glutathione redox status, right? So they're measuring blood tests. They're actually quantifying things. There was a 20% reported increase in hyperactivity. That commonly happens with B12 and also folinic acid. B vitamins tend to do that, as you know, so no surprise there. Let's go to the 2018 study. This is what a lot of people will say is this pivotal study that really got people interested and was more of a jumping off point. So Dr. Frye and his associates in 2018 in the United States did a double-blind, placebo-controlled study, and they did subtype it with glutathione, so they were getting very specific, right? So it was 48 children, folinic acid, the dose was 2 milligrams per kilogram per day, and again, duration 12 weeks. And in this, they were able to see better verbal communication, especially if the child was positive for the FRAT. So again, doing the test really helps be able to have focus as to if this is a priority for your patient. And again, adverse effects across the board is very, very minimal. Folinic acid, vitamin B9, it's water soluble, right? Excess is going to get peed out. Then there was another study in 2020, this time in France. So I definitely want to highlight that this is not just being studied in the US. These are worldwide studies that are ongoing. So studied 2020 in France, again, double blind, 19 children, on the smaller side, again, dosing about the same, 12-week duration, and you see improvement, adverse effects, none reported. Let's go to 2021. This is in Iran, double blind, 55 children. Again, dose is the same. This was with risperidone. So important to keep that in mind. It's not as if it's folinic acid or nothing, right? So you have options here. Duration here was 10 weeks. Again, you see improvement in speech and a variety of other things, and no reported adverse effects. All right, now we have a study done in 2024 in India. Again, double blind, 80 children this time. Very nice number. We're increasing in that. Again, dose is the same. The duration here is 24 weeks. So again, it's great to see this studied longer and longer. And so again, they saw reduction in CAR scores, and obviously it's better if the FRAT test is done and it's positive, right? So those are the children that seem, based upon the research, that can really benefit from it. And that's why doing the FRAT test, of course, makes sense, so that you can understand, does this child really need this intervention or not? And the last study I'll cover here is 2025 in Singapore. This was open label. 10 children, so small size. Again, dose is the same, 2 milligrams per kilogram per day. Duration here is 24 weeks, so very nice. They had a 12-week control and a 12-week treatment arm. And again, they saw improvements with no adverse effects. And that's really, I'm sure, what you're looking for is what are the improvements potentially, and then what are the adverse effects that have been shown. And so the science is showing adverse effects are really minimal. Now, if you go too fast with dosing, this is where conversations need to be had. Hyperactivity, aggressiveness, irritability, that can all happen if the dose is given too quickly, too much. So there is a little bit of an art of titrating this up so that there is minimal disruption. So that's a summary of the research that's been done on leucovorin in clinical trials with kids with autism worldwide. So it gives you hopefully a larger perspective of leucovorin in autism. And these aren't anecdotes, right? You can see it's peer-reviewed clinical research. I have the references there. I've compiled all the different citations and study details. You can certainly go pull all the publications and read that yourself. Mainstream medical education hasn't caught up yet. And it's because folinic acid is generic. There's no large-scale marketing or sponsored conference session, all of the things that you're familiar with in how cutting edge research gets to you is not going to happen in autism for a generic drug. So this leaves busy physicians like you have to rely on your own limited time to do research and investigate it. And I certainly know how impossible that can be in the middle of a packed clinical schedule. There's so much demands on your time. So this video is really meant to be helpful and a summary. And this is where my work comes in, translating the science so you have the full picture without losing hours of research that you, quite frankly, don't have, but would love to have. So if you decide to explore this with patients, here's what the literature shows. Benefit is most likely in children with the folate receptor alpha autoantibodies. Doing the FRAT test. It's a blood test, not anyone's favorite thing to do on a child, but it really helps to be able to focus and get specific. Dosing in studies, look at those slides that I have. Dosing is hugely important to get it right in order to see the benefit. So dosing, I'm not going to go into dosing too much here. That's definitely a conversation for parents to have with their doctors, and I'm not getting in the middle of dosing. Duration, so most studies were 12 weeks. You want to set parents' expectations because they're seeing these TikTok videos and parents are saying, oh my gosh, my child's talking overnight, right? So they give one dose of the Leucovorin and they're expecting every single thing to change. So really managing their expectations is important. And so I wanted you to see how long the clinical trials were done so you can really manage their expectations as well as you. It'd be great to have monthly check-ins with your patients to see how they're doing so that you get a lot more familiar with prescribing and the dosing and things like that. Adverse side effects are very minimal. However, like I mentioned, hyperactivity, some GI symptoms do occur, and they certainly can be intense if dosing is not correct. So just keep that in mind. But overall, adverse side effects from Leucovorin are very, very minimal. Now, I am not providing a protocol here. I am just ensuring that your medical decision-making is informed by the most complete and current evidence available. My mission is to make high-quality autism science accessible to both parents and healthcare professionals so that decisions are based on facts, quality facts, not trends, not fears, not hype. If you're a physician, you already know the weight of the decisions you make. I respect that deeply. That's why I'm committed to being your go-to resource for clear, trustworthy, fully referenced autism research. If you want to get in touch with me, you certainly can send me an email. I can send you the complete slide deck if you want with every citation. I'll put my email address below. I'm Dr. Theresa Lyons. I'm turning autism complexity into clarity for families, for clinicians, for better outcomes for kids with autism. There's a lot of great research out there, but it's hard to stay up to date. Let me help.